Welcome back to the Limitless Male podcast, where we are redefining the conversation around men's health. I'm your host, Jess Goldoni. In today's episode, we're sitting down with Sean Evans, patient and team member at Limitless Male, and he's going to tell us exactly what to expect step by step after you choose to take control of your health. Welcome, Sean. I'm very excited to get into your story. But I want to, and it's incredibly moving, and I want to hear all about how you made the decision. But I want to dive into really quick, what's next? What happens when, from your perspective as a patient, what happens when you've made that decision and you want to come in and get help? And you want to get tested or just see what's going on. I really want to get into the specifics of what can our listeners expect, because it's such a gray area. There's so much stigma around it, and we just don't talk about men's health. Sure. And I mean, I know that on the women's side, we kind of talk through what to expect when you go to your annual exam, that sort of thing. But what does a guy expect? How does this process work?
Sure.
Take me from the beginning.
So starting out, a lot of people will call in to schedule that first appointment. It's pretty easy. They just set up a time. Now on that first appointment, they're going to be drawing blood so they can do the blood work and get the test results and whatnot. So that part does have to take place in the morning. I think it's an 11 o'clock cutoff for that.
Yeah. Now, why is that? From what I know, it's because your testosterone fluctuates during the day and it's the highest, and so if you want to get an accurate value, you want to do it in the morning after abstaining from sex and workouts and things like that, those things that actually do boost your testosterone. But you want to get an accurate reading so that the provider knows where you're at baseline. Exactly. And also that way they can get an accurate reading so that you can qualify for like insurance and things like that as well. So it's definitely worth your time going in early so you can get those, insurance, right. And it's pretty quick. I mean, you come in, just get your blood drawn and talk with the provider for a little bit. And
yep. So yeah, when you walk in, you have to fill out the regular, first time at a doctor type medical information. Nothing out of the normal there. They'll call you into the back, take your vitals. I mean, very typical going to the doctor type experience. They'll draw your blood, and then they'll kind of really ask, like, why are you here? What are you hoping to achieve? What are your goals? What are your symptoms? And they'll kind of go through the different areas as far as, is it, do you want to gain muscle? Do you want to lose fat? Do you need some help in the bedroom? Energy levels, better sleep, focus.
And they actually listen to you.
Mm-hmm. Yeah, they'll go through every single step. They'll ask, hey, is this an area that you need help with? And kind of talk about what your goals are, what you're hoping to achieve, any worries, concerns, things like that. And then based on that information, the provider will talk to you about, kind of a game plan. How are we going to go about achieving these goals or attacking these problems? And, depending on what sort of help you're looking for, they'll go into more depth on those topics. And just let you know what the options are as far as the different treatments we provide. Just so you a lot of times you don't know what you can even do to achieve those results. And a lot of times there's multiple ways to get those results depending on your situation or kind of what you're going through.
And take me through your headspace a little bit. At any point, did you feel judged or that there was something wrong with you?
No, it was a little bit different for me since I work with everybody that I saw there. I do onboarding with them, and
which actually probably makes it even more nerve-wracking.
Yeah, it's like I already know these people a bit, and I'm talking about personal issues, but they were totally professional the whole time. I never felt uncomfortable, and it's kind of weird being an HR generalist and you're sitting there with someone you onboarded and you're talking about your sex life with your wife and other things like that. It's like this. I feel like I should have to fill out paperwork on myself when I get done with this.
An HR complaint,
right? So that was a little bit weird right at first, but 10 seconds into the conversation, it was like they just want to help me. They just want to help me get the results I'm looking for, and
make you feel comfortable.
Exactly. Yeah.
And let you know that you're not alone, and no one gets judged walking in there. We're all there just to help you.
Yeah. There's a lot of times when you're going through something like that, you feel like it's, oh, there's something wrong with me, or I'm the only one, or I'm the whatever it is, that especially if you're not in a good mental space because of what you're going through, it's every guy goes through certain, you're aging. It's everybody gets older. So it's so much more common than most people think. And the people that you're talking to have a lot of experience in helping with those exact issues. So it's not like, oh, this guy is, out of the norm because he's getting older. He's, gaining weight as he gets older and or whatever the case.
In fact, I think it's the exact opposite. What I hear in the clinic is all of the success stories, and they're bragging on you, and they're saying, oh my gosh, you look fantastic.
Yeah.
Like, what happened? I mean, what are that looks like that's working, or the peptide that you're on, or, that GLP-1 medication, you lost 100 pounds or whatever it is. I mean, there's a lot of cheering going on, I think, because they all get to know you on a personal level.
Absolutely. It really feels like they get invested in you, and they're rooting for your success, and they like being a part of that. And that's half the fun, is going in and sharing the success stories with everybody, and giving fist bumps and high fives as you walk through the lobby or whatever. It's a cool experience to see it all come together and then see the results. And when you leave the clinic, it's not just, oh, I'm gonna have better sleep or lose weight or more energy. It's, I'm going to be a better me. Everything I do is going to be better now, because the foundation of my life has just been improved. And that's huge.
It's huge. So that first appointment, you're getting your blood tested. You're hearing about kind of an overarching menu of everything that they can do for you to help your goals. Then you make your second appointment, and we do, you do that so that you get that full blood panel done.
Yep.
So the provider can actually sit down and analyze it and talk through it with you.
Yep.
And so that's the second appointment. You come in and they talk through what your results mean.
Yeah.
And what to expect and what you can do about it now. So it's confirmed you have low testosterone or whatever else that you're dealing with.
Sure.
And this is what I recommend, because they put a full treatment, like a custom treatment plan or something together.
Yeah, you see all the different symptoms, the things that you talk about that you want to improve on or that you're interested in. They'll check those off. You get to keep that. So it's almost like a playbook. Like, this is what we're planning on doing moving forward. And then when you go in for that second appointment, it's kind of a follow-up. Like, so based on your symptoms, this is kind of what we thought. Here are the results to either prove that, or maybe it's a little bit different than what we thought, but so here's the way that we're going to treat that instead. So, they'll adjust as need be. And then from there, they'll get you a prescription ready to go, and just, you kind of know what your plan of attack is, know what to expect. You'll go back in for monthly tests just to make sure that your levels are where they should be, and that you're not having any side effects or any unwanted issues or things like that. And then that's really, to me, the best part is, like, then you start seeing results and you start feeling better, and going back in and getting checked up, and just it's like routine maintenance at that point, like
maintenance on your car.
Basically. Yeah. You don't want to go in with low oil or or whatever.
So maintenance on your car. So you come in for the first, you get your oil checked. Then you come in for the second, you get your roadmap, your game plan. You can actually get the medicine that day. You can get an injection that day, right? On the second appointment?
Yeah, if all the things line up, like if you qualify and all of that, yeah. It was a lot faster of a process than I thought, because I know by the time I was like, let's get tested, like, I was like, I just want to start. I want to get going.
Right.
I want to start feeling these results and improving my life. So, that's, to me, that was like the hardest part, is just waiting, like, oh, I'm ready to go now. Now that I've reached out and kind of got through that little bit of embarrassment or awkwardness, it wasn't nearly as bad as I thought it was going to be. And it's like, let's do this. Let's get going.
Well, thank you so much for taking us through the process. I know that was probably what everybody was really eager to hear, because nobody knows what happens after you make that decision. So I want to hear a little bit more about you and about your story. So why don't you go ahead and take me through that?
Right on. Well, I have been working at Limitless for right about a year and a half now. When I was first wrapping up in college, I thought I wanted to be involved in mental health, be a psychiatrist, psychologist, something along those lines. And about a semester before graduation, I realized that how easily I empathize with people. If I had a patient or a client who self-harmed or relapsed or, took their own life or something along those lines, I just knew I'd be the guy awake at 3 a.m. the rest of my life thinking, oh, I should have said this, or I should have known, or I should have whatever. So
Too much pressure.
Exactly, yeah. And just decided to change directions. And I wasn't very happy about it at the time, but sometimes things just work out, and not the way you intended, but I'm really glad it did the way it did, because I can still scratch that itch of helping people, just not how I originally thought it would be.
Right. So what do you do at Limitless?
I'm the HR generalist.
And what does that mean?
So a whole lot of stuff. A lot of multitasking. It's one of the big things I do is onboarding all the new employees who come in. I kind of introduce them to what the company's going to be like and kind of walk them through the regular first day of work type stuff, and then just kind of what we're all about. And
so you're literally the first impression of Limitless that a lot of the employees have.
Yeah, more or less. Yeah. After the recruiting process, it's, we'll get a welcome them aboard. So it's pretty cool.
Okay. Pretend that I am a new hire. What's one of the first things that you tell me about Limitless?
The things that jump out are, one of the first things I like to emphasize is there are a lot of different places guys can go for the type of services we provide. Bunch of different companies they can go to for testosterone replacement, help in the bedroom. Heck, guys can go online and get Blue Chew, not even have to talk to a person in person. The reason why they come back to Limitless is because of that interaction they have with our team. When they come in the front door, they are greeted by their first name. I also explain to them I'm a patient as well, so I've got to have the privilege of having these experiences where I'll be in the waiting room and I'll see our front desk PRCs greet the guys as they come in, and it's, hey Bob, how's it going? How was your daughter's wedding? How was your hunting trip? How was your whatever? And you can see the guys as they're walking in, like you can tell right away, like, oh, he's excited to share a success story, or he's got something he wants to talk about. And that keeps on when you go into the back, you talk with the clinical staff, the provider, the PEMs. They all know the guys who are coming in. They know their story, their goals, and it's kind of like hey, let's share this journey together. And that's why they keep coming back to Limitless. It's that interaction, and that you don't have to do it alone once you get there. There's kind of a guide, because it can be a scary thing. And so to know you've got these different people who care about your story and want to help you get to your goals, it's to me, that's the difference from Limitless to other places.
Right. Now that's interesting. So you are yourself a patient. So I want to know a little bit about, tell me a little bit about that in terms of first of all, what work have you done in your life, and have you wanted to seek treatment before? Is this something you just did Limitless, or take me a little bit of your background? What kind of things have you faced?
With that, and it's kind of funny, depending on how long you've known me, this is either really surprising to people or they're like, yeah, that checks out. I spent a large part of my life struggling with depression, trying to work through, just toughing it out. There was a good chunk of time where I was just so depressed so often. I felt like a burden on the people that cared about me. And it was one of those situations where I remember being up at night sometimes thinking, like, if I wasn't such a coward, I would just end it so I wouldn't inflict myself on the people that I cared about. And I would tell myself, like, yeah, sure, they'd be upset for a little bit, but then their lives would be so much better without me there. And it's crazy to think about now looking back, because it's like, oh, I couldn't have been more incorrect on that, but it was very real.
And speaking from an outside perspective, I would never have guessed that, because you have a smile on your face constantly, and there's a reason you are the first impression for employees, because you have such a warm, welcoming, positive energy. And I think that might be why you're so easy to talk to, because you've been there. And I think that people like you and me that have struggled in our own struggles, we have more patience, more empathy, and maybe just a little bit more of a lighthearted view of some things that aren't typically lighthearted.
Right. Yeah.
Because we've been there. We've been where it's been dark, and
Exactly.
we know that you can get through it. But
Yeah.
so you did a lot of work early on mental health and getting yourself to a place. But then what was that moment that you're like, okay, there might be something else here? Was it after learning about men's health a little bit more? I mean, did you know about a lot of it before you started?
So with that, about 4 or 5 years ago, that was like where a big change in my life. I ended up going to counseling, did brain spotting therapy, which was just a crazy difference right away. I didn't think I didn't feel like I could go through that big of a change, especially in a relatively short amount of time. But so it's kind of funny. And sometimes I feel like a little kid, like I'm like 4 or 5 years old, like, oh, I get to be the me I've always wanted to be. And it's just such a weight off. And so once that took place, I was like, now I can start being me, and I can, go do all these things that I wanted to do. And I had all these plans, and I was so excited, but then I just couldn't get going. Mm-hmm. And I was like, I've taken care of the issue. Like, why can't I do it?
Right.
And
you already went through all the hard work.
Right. Yeah. And it's back when I was dealing with the depression, it would have been more of if I loved my kids enough, or if I loved my wife enough, or if I whatever, I would just man up and get through this and just deal with it. But it was like a hollow version of depression. I just couldn't get any traction. And one of the things that jumped out at me, I heard once that sometimes the symptoms of low testosterone are very similar to the symptoms of depression. And I knew it wasn't the same as depression, but I was like, is this just a different level of it now that I've kind of gotten past?
Like in a video game.
Yeah.
Like you've gotten this level. Now it's like, okay, now I'm meeting the big boss.
Right. Well, it was better and worse, because it's like, I feel like I'm finally able to do things. So why can't I do the things that I feel like I'm able to do finally?
And that you want to do.
Exactly.
I mean, you genuinely had a feast for life, and you had a new renewed sense of vigor. But you still couldn't
get it going. And so that was one of the things that, like I said, when I found out that the low testosterone symptoms are very similar to the depression, symptoms, and it got to the point with me where I was like, I struggled with that for so long. I don't know how long I've got here driving this meat robot around on Earth. I don't want to waste any more time. I want to be the best dad I can be, the best husband I can be, the best me I can be. And at first I wasn't able to do those things for myself because I just didn't feel like I was worth it. But I realized that if I take care of myself and do the things I need to do for myself, I'll be able to be better at everything else. It's the foundation you're building your life on, is your mental and physical self. And so it's like, I got to stop wasting time. I remember it was actually during COVID, there was a commercial on, and it talked about asking for help is a sign of strength. And I got so angry because that hurt me. Because I was like, I feel so weak and helpless. That doesn't seem like a sign of strength, that I can't be the dad I want to be.
You just can't do it yourself.
Right.
You can't just man up and do it yourself.
Exactly. And it's one of those things too, where if I would have broken my leg, I'm going to go to the doctor and get it, have surgery or whatever. But when it's something that sometimes if you really focus on it, you can kind of push through a little bit, and so it's like, maybe it's just I don't want it bad enough, or something along those lines. And you can, especially if you already feel bad about yourself, you're going to just put it on yourself. Like, if I cared more, if I wanted it more,
right?
Those things.
God, the things I could get done if I could just will it into existence, that if I could just force myself to do things, unstoppable,
right?
Unstoppable.
Yeah. It's crazy what a difference it makes when you have that energy behind those thoughts and desires. And it's like, wow, I can actually make good on all these things that I wanted to do. And just seeing the difference it makes day to day. Like I said a minute ago, I don't know how long I've got. I don't want to waste a night because I'm just too tired to get off the couch. And that was the thing that jumped out at me as well. Like, if my wife asked me to do something, or if my kids wanted to do something, I could do it. If it was something for me, I'm too tired, I'll get to it later. Is it that important?
Right.
That sort of thing.
And did you find yourself, when they're asking you to do something and you really don't want to do it and you really don't have the energy, is it again that voice in your head that's, gosh, Sean, I mean, come on, you could be a better dad. You need to do this. It's kind of being mean to yourself, but just to force yourself to do something.
Yeah, and I'm glad you brought that up. That's a big difference now. I used a lot of like negative motivation previously, where like, don't be a punk, get up, do it, don't let everyone down, that sort of thing. And now it's like, let's make memories. Let's go do fun stuff. Let's take care of, even if it's something that's not that fun, let's get it out of the way so we can go do those things. Right. And live your life.
All right. Now tell me about the moment. I know you were doing a lot of research and hands-on training, with the Limitless staff, but where was that moment where you're like, okay, there's a little voice in me saying that, yeah, this could be something else. This could be low T. This could be treatable. Talk me through that, and then talk me through finally getting that test.
So it was one of those things where, just being at Limitless and hearing the employees talk about different success stories and interacting with the patients and whatnot, it was like, seems very familiar. I've heard versions of this in my head over and over again. And it's one of those things where it's like, okay, so I get the test, the results are fine. At least I can check it off, and I know that's not the case.
Right.
It's not like once you get the test done, you have to do anything.
Right.
Why not at least know what the problem is, or if it's a problem?
You don't know what you don't know.
Exactly. Yeah. So
okay. So you think you might have a problem. You make that decision, and you go in and get tested. Then what happened?
I had a ton of questions at first, even working at Limitless. Just, what does this mean for me? How's it going to look like in my life? How quick are the changes going to take place? All that sort of thing. And it was actually really cool to, see the employees that I've interacted with in other aspects. Maybe I'm helping them with benefits or a question on PTO or whatever. Just seeing how good they are at their jobs. I'm regularly just so impressed at how attentive they are. They're always checking in. Are you meeting your goals? Any side effects, any issues, any additional things you want to look into? Always kind of just there to support me, and just see if there's anything else that can be done or that can be better. But going in and having those first conversations, they really kind of lay out, this is kind of the roadmap of what we expect. Once they get the blood test results back and whatnot, then you kind of have a plan of attack already established. But they went over the things that I was hoping to achieve by getting treatment. Let me know what the different options were, kind of explained everything in a way that made sense, in layman's terms and whatnot. So I already kind of had that plan of attack planned out before I even got the results back. And then it was just, once those came in, just getting started was a lot easier than I thought it would be. Like, I'm currently on testosterone replacement, and then I also take peptides. So for that, I do injections 5 nights a week at home. And then, I go in weekly for a testosterone shot and usually get a vitamin B shot as well. I'm ready there. Might as well just poke me again and give me some more energy.
Okay, I want to get all into your treatment for sure, but I want to hear, what was it like to hear you were low?
It really wasn't that surprising, to be honest. I actually, a couple years before that, I did get tested and was low, and I was on testosterone for a little bit, but they didn't give me any of the other medications that Limitless will prescribe right away. So I was super up and down emotional. It was my wife came into the bathroom. It was about 2 or 3 days after I started my first injections, and my nipples were enormous. I was like, this better not be forever. I regret this big time. But I had zero side effects with Limitless. They got me on the right meds right away.
Nipples the right size?
Yeah, right. They went back to normal and
Good.
Stayed that way. So, but yeah, like I was like, this is like a bad dream.
Well, that's what happens when you have someone that, a provider that well-intentioned, but they just do testosterone, like you said.
Right.
And then they don't prepare for or treat what a hormone will do to your body.
Yeah, it seems like in my experience with that, they're more kind of reactionary. Like, oh, that happened. Well, let's see what we can do. But when you specialize in it, those things to look out for beforehand, so you don't have to go through those ups and downs. And yeah, the emotions were crazy. So it was, and then with that, the other thing, it cost a lot to get tested regularly through my, general practitioner. And that was the reason why I stopped taking it, besides the fact that I was super depressed and didn't have the motivation, but I just couldn't afford the tests regularly. So I didn't get far enough to even see any results besides the bad side effects.
Right. Oh, I can't even imagine.
Yeah.
It would have been double hard, I can imagine, I've already done this once. I got giant nipples out of it. It was really expensive. I couldn't get tested or monitored. And now I'm going to try this again. What if it goes the same way? But I mean, hearing all the stories, obviously. So here you are, and it's been 6 months?
Right about 6 months, yeah. Yeah.
How are you?
I feel physically like I finally matched my mental level of happiness now. My energy is... This is the way that I've put it to my wife and my friends. I keep telling them, just go get tested, just see. I'll explain whatever you need to know. Not that they won't do it while you're there, but please. It's made such a difference to me. If you'd have asked me how I felt physically, or just how I felt 6-7 months ago, I would have said mentally better than ever. Physically, it is what it is. I just turned 40. I don't feel bad.
No.
But if I sleep on the couch wrong, it hurts. That didn't happen in my 20s or whatever,
Sneeze wrong.
Right.
Yeah. Just
eating the wrong foods can hurt for a day.
Oh, gosh.
Weird stuff like that.
Don't even get started on a hangover.
Yeah, it's scary to even think about. But yeah, so this is just getting older. I just thought it was normal. Right. If I woke up tomorrow and felt like I did 6 or 7 months ago, I'd go to the emergency room. I feel so much better. It's a massive difference.
Now, how? Like, specifically, if you feel so much better, it's energy, clarity, like, what do you... Because I think a lot of times, and I know that the patients too, they're like, oh yeah, I'm sure I feel fine, not remembering how they felt 6 months ago compared to how they feel now. I mean, what can you point to specifically that you feel is different?
And it kind of reminds me, there's lyrics to a song. It's the gradual descent into a life I never meant. And you don't realize that it's getting worse. Yes. And those things kind of accumulate. And it's just, God, this is just what life is like. Because if it happened overnight, it'd be like, oh, something horrible has gone on. But you just kind of ease into it and don't realize it. The way I try to describe it to my friends is like, everyone has those good days where you wake up and you're not tired and you're ready to go, and everything just seems to go right, getting ready for work, and you get in the car and your favorite song's on the radio and you're hitting green lights, and it just like that kind of vibe happens way more often now than it did before, and it's easier to bounce back from setbacks. And I've just got energy to do stuff.
Right. And do you actually do it? That's the...
Yes, it's great. It's I've been assistant coaching on my daughter's volleyball team.
First time?
Yeah, it's a lot of fun. It's our final regular season game is tonight. It's been such a blast going and doing that a couple times a week, and it's there are days where, as I was kind of getting used to being on TRT and the peptides and whatnot, I was like, oh man, there's practice tonight. I'm going to be exhausted. And then, fast forward a couple hours later, I'm running laps with the girls and, playing scrimmage and whatnot and having a blast. And it's like, that would not have happened. I would have wanted to do that, but it would have been so hard.
So you said that now when you're asked how you are, before you would have said mentally I'm great, but physically, I'm 40. Now do you feel that mentally, physically not only has synced up, but that you're the Sean that you wanted to be?
Yeah, it's I'm able to just, I don't have to think like, oh, do I have the energy for this or should I do that? Like I just kind of do things now. I just am doing the things I want to do and taking part in my life instead of watching from the sidelines on stuff. One of the things that has really blown me away is how quickly I recover from workouts now. There's been days where I'm like, man, I'm going to be sore for like 5 or 6 days. A lot of I play a lot of virtual reality boxing and things like that. It's a blast. My daughter and I all do kung fu against ninjas on VR in the basement and whatnot. And it's to me, I can trick myself into working out. Like if I'm on the couch after work, I ask myself, like, do I want to go do kettlebell, lift weights, battle rope? Sometimes I do, but, maybe not. But if I'm like, I go play video games for a bit,
right?
Sneak in a workout. It's like a cheat code for me. I can work up the energy to do that almost any night.
That's a good tip.
Yeah,
make it fun,
right? For real. Yeah, it's if you're having fun, everything's a little bit easier, But the soreness goes away so much faster. Like
right.
I wouldn't have believed it if you would have told me how quickly I would be recovering from that stuff. Like there was one morning after a pretty intense workout, it was hard to pull my pants up in the morning because my arms were so sore. I was like, oh, it's going to be a horrible day. I'm going to walk around like an old man all day. And by like 3 that afternoon, I was like, I actually feel all right.
Right.
And I was able to get back to it that same night. So it's crazy.
That's awesome.
Far beyond what I would have expected.
That's really awesome. And it's awesome to hear from not only someone that has tried it before, has struggled with it before, struggled with mental, issues as well, but also worked at Limitless. And, it took a while for you to take that step and actually go through treatment. So what would you tell your friends or someone that is hesitant to come in and you said just get tested, you don't know what you don't know, but what are you going to tell them about if they're low? Like once they come in, what happens then?
I would say first of all with that I really think the hardest part is just making that initial call, going in the first time, because that's a part you have to do by yourself. Once you do that, you've got help and support. You can ask questions. There's a path you can follow. And so that's the most important step, I think, is just that initial reaching out. I think I can be better. I think I can live a better life, whatever it is.
Right.
And then the other thing is like when I talk to my friends and tell them to go, get tested, that sort of thing, none of them are like, oh, that sounds terrible. Like, yeah, no, that sounds good. I'll get to it. And it's like, how long do you have just in life? No one knows. Why waste a week, a day, a month, a year, whatever? Why put it off? You could be a better you. The sooner you go in, the sooner you're going to be the you that you can really be. That's possible to become. So why wait to enjoy your life more and have more fun and be a better everything?
Because it's black and white. We all get one shot at this.
Right.
One.
Yeah.
We don't get do-overs.
Right.
This is it. So why wait?
Exactly.
Exactly.
Yeah. Why put it off?
Because it's fixable and you can take care of it. And It's easy. And what I think is the most important thing is you had to do a lot of improvement alone.
Yeah.
But in this type of situation, like you said, the only thing you have to do alone is the first call, the first initial contact.
Right.
Because then once you come in, you have an entire team behind you.
Yep.
That will help you and help you get to your goals.
And that's one thing that I think is cool as well. Like, and I've related it to like doing jujitsu, where I learning a certain technique. Sometimes a coach will say something and it's like, I don't quite get what you mean. And then another coach can say it and it's like, oh, that clicked. I get it.
Right.
You get different perspectives on what this does, how it helps. Maybe symptoms you don't realize are treatable even, and so hearing it from the different perspectives, talking to the front desk, the clinical staff, the providers, patient experience team, they all have different stories, different insights, different knowledge that they've picked up, other people's victories and, lessons and things like that. So there's a whole lot of resources there to help you get to your goals. And you don't know they're there if you don't search for them, I guess.
Exactly. Sean, this has been fantastic. Thank you so much for sharing your story. I think that you've done today what you typically do with onboarding, sharing stories and introducing everybody to Limitless Male, but hopefully you've done it on a bigger scale and we can help change this conversation and just make it more the norm and let everybody know that they're not alone.
Yeah, I hope so. If one person makes the decision to go in and improve their lives, it's been well worth it. So
awesome. Well, thank you so much.
Well, thank you.
Appreciate you.
Appreciate you.
Thank you for joining us today. Now it's your turn. Time to take control of your health. Check out the show notes for more information and to book your consult.